It's a Northwest Lifestyle Weekend on Como News. Here's Tom Hutler and Shannon O'Kelley with more IRG Health Talk.
All right, our next guest is Simon Katumu, a family nurse practitioner from Pacific Medical Centers in Puyallup. We're talking about COPD today. Here's Shannon O'Kelley and Simon Katumu.
Simon, welcome to Health Talk. How are you?
I'm very good, thank you.
Thanks for joining us. Tell our listeners about your practice. You're a nurse practitioner. Tell us your area of interest, your focus. Kind of give us a background. I mean, you're new to the area. You just recently moved, I believe, from St. Louis.
Yes.
Left the Midwest to come to the Northwest.
Yes, my family and I just moved here from the Midwest, and we love it here so far. We love the weather, the people, everything about the city. I work in family practice. So this is an area of medicine where we essentially see patients of all ages with all different kinds of conditions. And then sometimes we refer people to specialties, but we do primarily everything.
You tell us your role as a nurse practitioner. I mean, I think our listeners, I always have a keen interest on kind of how one becomes interested in that, what led you to family practice, and what your background is in your training.
I'm originally from Kenya, so I was born and raised in Kenya, and from a young age I had this desire to impact people's lives and just to be able to touch people's lives in whatever little ways I can. I grew up in a small village where there was not much healthcare services, and just seeing people going without very basic care prompted me to want to make a difference in people's lives. And so I decided to go on this path, and I first became a registered nurse, went to school in St. Louis, and I felt that I wanted to do more and went back to school, got a master's degree, and finally my doctorate degree. So as a family nurse practitioner, I see patients throughout their entire lives, kids, adults, older patients, and essentially what we do is we listen to our patients. We want to see what's going on in their lives, what they're dealing with, and then try to offer them whatever services we can. It all starts with talking to people, getting to know them, getting to know what issues they're dealing with, and then offering options for treatments. It's not a one-size-fits-all. Everybody is different. Two people can have the same medical conditions, but then what works for one person may not work for the other person. So just getting to know what works for one person and trying to meet them at their level.
Boy, I tell you, that is so important. I'm so glad you're talking about that, the listening and building a relationship with your patient. I mean, as a physical therapist, that is our cornerstone of what we practice, is listening. And I think I'm concerned sometimes, and maybe you have the same experience, that as practitioners, sometimes are we being pushed too much where we're losing the opportunity to really engage and listen to our patients? And that is so important in a family physician world and family practice world. I mean, I'm glad you're talking about listening to your patients.
True. And there's so much information that patients have access to. Yes. So patients talk to their loved ones, they read stuff online and things like that. And it's good to be informed about different things. So I feel that as healthcare practitioners, our biggest role is really to be a coach to our patients. When my patients come and sit in the office with me, sometimes they have conflicting information. They're wondering, what should I do about this? What should I do about this? And I don't feel like my role is to tell them do A, B, C. My role is to give them information and tell them, okay, this is what's going on. These are the options. And then, because like I said, not two people are the same. What works for one person may not work for another person, but just giving patients options and educating them. I believe that healthcare practitioners, our biggest role is probably education and coaching patients.
Absolutely. Absolutely. Let me ask you, you probably have an interesting perspective on healthcare. You said that you were born in a small village in Kenya, and here you come to this country. I mean, we have a fantastic healthcare system from technology, from, practitioners, very skilled. But what's your perspective, having been raised in Kenya and now practicing in our healthcare system?
One thing I'm really grateful for is having a little bit of both worlds.
Yeah.
Coming from one perspective where culturally healthcare is perceived in one way, and then being here where there's so much, and just being able to see the differences and take advantage of both. I grew up in a society where people don't typically go to the doctor's office or to the hospital unless they're sick. So the concept of preventative healthcare is a little bit foreign to them. And here we have so much, and I always try to encourage my patients, it's good to be proactive and don't wait until something is wrong to try and fix it. Just like we do all changes on our cars, and we don't wait until our cars start making funny noises to go to the mechanic. Otherwise, you're going to end up spending more money. But if you're proactive and take advantage of the resources that we have, that works a lot better.
Our conversation with Shannon O'Kelley and Simon Katumu continues on Como.
It's a Northwest Lifestyle Weekend on Como News. Now back to IRG's Health Talk.
Back to more of Simon Katumu and Shannon O'Kelley talking about COPD.
Simon, thank you so much for joining us here on Health Talk. You're doing a great job. I mean, I love your perspective on healthcare, and particularly your intent and your interest in building relationships with patients. That is so important. The soft skills are so important. One of the things we want to talk about today in your practice is lung function and COPD. So let's kind of get into that, because that can be a very difficult thing for a patient to live with. And, when you can't breathe, I mean, that's scary, right?
Nothing matters if you can't breathe.
Yeah, exactly. So tell us about COPD, chronic obstructive pulmonary disease.
All right. So COPD, just like you defined it, chronic obstructive pulmonary disease, is a disease of the lungs that is chronic and oftentimes irreversible. COPD is an umbrella term that's used to describe more than one condition. So there's mainly two forms of COPD, emphysema and chronic bronchitis. Asthma can sometimes be categorized as COPD as well, even though asthma is sometimes reversible versus chronic COPD, which is usually irreversible. And essentially, COPD affects the lungs, making the work of the lungs harder. The main primary function of the lungs is to allow gaseous exchange. When we breathe in air, and then in the lungs is where blood and oxygen get to mix, and therefore we get circulation and flow of oxygen throughout our entire bodies.
It's a fascinating system. If you ever get a chance to read and just study the lung and the gas exchange, what's causing the obstruction? It's scary.
True. And like you're saying, the process of how the body just converts air that we breathe in into oxygen flowing our veins and being supplied everywhere, it's just amazing how the body works. And like you said, there is usually with COPD, you can either have a cause of obstruction, which is decreased the ability of the body to get rid of CO2, carbon dioxide from the lungs, versus restriction, which could be due to other conditions such as lung tumors and things of that nature. So both conditions, either restrictive or obstruction, cause the inability of the body to have the process of gaseous exchange happen as it should be. And typically people with COPD will develop symptoms such as chronic coughs, shortness of breath that goes on and on and on and on. And if nothing is done to mitigate the problem, it could get worse and even eventually cause death and other complications.
And what can you do to mitigate the problem? What kind of intervention can you do as a practitioner?
So the first thing is, what causes COPD? Treating the problem is not always the hardest part, is knowing what caused the problem in the first place. And if we can identify the cause of the problem in the first place, then we can try to get rid of the mitigating factors and try to alleviate the symptoms. So there are multiple factors for the development of COPD. The primary one is smoking. About 80 to 90% of cases of COPD are related to smoking. The other factors are such as exposure to occupational hazards, air pollution, genetic factors, and things like that. For example, the person who is a chronic smoker has been smoking for many years. Stopping the smoking would be a great way to start dealing with the problem. And then there are medications, there are treatments that are available. There are people with COPD who use inhalers and oxygen and things like that. Those are advanced cases, though. Yeah, right.
And the nice thing about it is if you get diagnosed, you can be treated. Simon, I want to thank you for your time and everything you do as a nurse practitioner. You're very passionate. I can tell you care about your patients. Thank you.
You're welcome.
Simon Katumu, our guest, family nurse practitioner from Pacific Medical Centers in Puyallup. COPD, I don't think on the top of my head would be something you guys deal with there, but...
No, we don't deal with it directly, but we're involved with it. We do have patients that come in that have COPD, and you have to be considerate of their breathing issues and their challenges. So yeah, we see it in our practice. It's part of what we treat around.
All right, more information at pacificmedicalcenters.org. Thanks to Simon Katumu. We'll be back with our final segment right after this time out on Como.